In other news, the new Omicron variant XE has been detected in the capital city, Bangkok. Our Bureau Chief, Crystal Bapa, will tell us more.
Thailand reported its first case of Omicron XE, a new hybrid of two previous versions of the Omicron variant in which the World Health Organization has warned about. The XE is a mutant hybrid of the BA1 and BA2 variants, which was found through genomic sequencing of a swab sample taken from a Thai patient, as reported by the Center for Medical Genomics at Ramatibodi Hospital. According to the center, the XE recombinant is not the Deltacron variant. The World Health Organization warned that Omicron XE could be the most transmissible strain, yet its severity is still being investigated. Reports from the UK Health Services Agency said the Omicron XE is 10% more transmissible than BA2 and 43% more transmissible than the original Omicron. The center also added that Omicron XE remains to be seen if it will become the dominant strain. 99.84% of all new COVID-19 cases in Thailand are of Omicron variant, and of this, 92.2% are of the BA2 subvariant. Meanwhile, Thailand logged 21,088 new infections today and 91 fatalities. Back to you, Esther.
Thank you, Crystal, for that update. You stay safe there in Bangkok.
You too, Esther. Reporting live from Bangkok, Thailand, I am Crystal Mapa. We live in interesting times.
In a related news now, as mentioned, Thailand reported its first case of Omicron XE. This is a combination of the two previous versions of the Omicron variant shortly after the WHO warned about this new hybrid. Now, here in the country, the Department of Health says it is working with the Philippine Genome Center to monitor the case trends and conducting genomic surveillance activities amid the threats of new and existing variants. An expert explains. Take a look.
This is a recombinant of the BA1 and BA2. So pinaghalo ang mutation ng BA1 and BA2. So that means it is expected that you will have a more transmissible variant or a COVID virus. And I think WHO has already mentioned that it is 10% more transmissible than the BA2. And you know, BA2 is the one that is the dominant variant now in most countries. And if you are looking at an XE Omicron more transmissible than this, then that will be really dangerous in terms of it might overlap and it might be the dominant variant of concern, although it's not been declared by the WHO as a variant of concern at this point in time. Those who are boosted, especially within 3 months, are still being able to protect ourselves. No, our immunity against this Omicron variant is still there. No. What's the concern now are those who received the primary vaccine series and has not received the booster dose, because when Omicron came, most of the effectiveness of the vaccine dropped significantly. And when you are giving the booster, it will be maintained higher, like 60 to 70%. So in short, we need to vaccinate and give the booster dose to the population now. Second booster is only recommended for those 60 years old and above, those who are immunocompromised. Why? Because these are the population with the first booster. It's not enough to build that immunity because of their conditions. But for you, without comorbidities, those less than 60 years old, then that will not be the priority. So you're still good with the first booster dose. Mask natin, no? We know that the face mask is the direct barrier against any aerosol or any airborne particles of the virus, no? Now, ang nangyayari ngayon, medyo kumakampante ang mga tao, nagtatanggal, no? So we need to emphasize again, no? The only way to be protected directly against aerosolization, droplet, is wearing the face mask properly and consistently.